This week on Act Out, talk, theories, ideologies, talk. A few words of wisdom from the past to serve as a reminder in the present and future, just in time for all the talk of the 2020 caucuses and primaries. Next, what if a call to 911 could mean a call to mental health and social workers instead of law enforcement? CAHOOTS outlines and shares possibilities. From tweets to marching in the streets, this is Act Out. Welcome to Act Out. I'm Eleanor Goldfield, and this is your tipping point. Anarchist Voltairine de Cleyre wrote, "Theories may be propounded by educated people and set down in books and discussed in libraries, sitting rooms, and lecture halls. But they will remain barren unless the people en masse work them out." As the Iowa caucuses loom and the shitstorm of primary season awaits ahead, it felt an apt time to bring up this quote. Because there's a lot of talk. Even more than usual. Mindless banter, slippery lip service, lies wrapped in flags and theories, oodles and oodles of theories. Ideological linchpins and hypothetical hills to die on. And don't get me wrong, I love some good political theory. Give me some science magazines, some Bookchin, Chomsky, Hedges, Goldman, and let's nerd out. But let's be clear about what we're doing. So often, theoretical battlegrounds create real divisions. They become barriers to real work because we'll only build with this person because they've read this, or they already agree on the specifics of democratic confederalism. And even more insidiously, this war is waged not just between ourselves, but on the highest levels. The right words are crafted by speechwriters who deliver talks dripping in keywords and hashtag-ready hot topics. The seduction of the masses via verbose opiates is a tried and true tactic going back thousands of years. In our spaces and our own minds, we must acknowledge the power of words, the power of theory, and the ultimate power of action. Education, conversation, and indeed theory are all important. We must not let the contemplation of change become more important than actively pushing for change, though. And some might say, well, if you don't know the theory, how can you act? We have to know what we're working towards. And while theory can offer guidelines to action, you don't need a degree in giving a fuck to give a fuck. That's just another fallacy, another barrier to collaboration and collective work. If you go out and talk to folks who haven't had the privilege of a good education, who don't have access or know where to start with all these theoretical treatises, they're not completely blind to reality. They know some shit is up. They know that they feel cast aside, isolated, used up, abandoned, and left for dead. And they are, in most cases, just as thirsty for change as we are. And this shared feeling, this is the foundation of our work. Use theory that you know, absolutely, but don't use it to exclude those who would be in the fight and build with you. Don't let knowledge be a barrier, but rather a bridge. Share knowledge, create knowledge, hash out knowledge, work it out, as de Cleyre wrote. Use it for what it is, a tool, a guide for change. And friends don't let friends and comrades hide behind theory. In December, I came across an article in the Dallas Observer that had some good news to peddle. Dallas police and fire departments teamed up with Parkland Hospital to rethink how they responded to 911 calls involving mental health crises. They placed a social worker inside the dispatch center to triage calls and sent out a special team staffed with a mental health professional whenever possible. They targeted South Central Dallas, an area with the highest concentration of mental health-related calls. The results have been remarkable. Folks with mental health problems are not only avoiding ERs, but more critically, they're avoiding jail and potentially violent interactions with police. Word about this program is spreading across Dallas and indeed across the country. And one of, if not the pioneer programs, is the CAHOOTS program via Whitebird Clinic in Eugene, Oregon, a powerhouse alternative for those who reach out to emergency services but for a variety of reasons don't want or really need law enforcement. CAHOOTS has been providing the community and indeed the local government with incredibly positive results now for years. Here to talk more about the program is Benjamin Brubaker, clinic co-coordinator at the Whitebird Clinic. Take a look.
So Whitebird Clinic started back in the late 60s, early 70s. It was started off basically by a group of some folks from the counterculture, some local kind of professionals, folks that just felt like there was a lot of drug experimentation going on. There were a lot of folks that felt pretty disenfranchised, didn't trust mainstream institutions. And they felt like a lot of situations were being made worse because people didn't feel like going to traditional, calling the police, calling the fire department, going to the ER, and they wanted a place where people could just go, a house that looked like a house that people would feel comfortable coming to when they were having a crisis of some kind, be it related to substances, be it related to mental health issues. Um, so they got some money together and purchased a house and opened up a 24/7 crisis line. And that crisis line has not shut down since the 1968-69 time that it started.
That's
Um,
impressive.
Early as Whitebird evolved, that same group of people kept looking out into the local community and seeing what the unmet needs were and looking for or trying to start programs that would help solve those things. And so they started seeing a lot of people who needed ongoing counseling. So they started a low-cost counseling program. They recognized that there was a need for low-cost medical care. So they got together with some medical folks and drug a trailer into the backyard and started a medical office out of it, of free, low-cost, no-cost medical care. And they kept on trying to solidify those things and finding funding streams, basically, that would allow those programs to actually be solid. And at this point now, we have homeless case management, ongoing counseling, outpatient substance abuse, benefits assistance, low cost, no cost dental care, low cost, no cost medical care. And so it just kept kind of evolving from there. One of the things the crisis team was doing early on was mobile intervention of sorts, where somebody would call and didn't seem like they really could come in, and they would jump in a car and go and get them. When I started Whitebird 12 years ago, that was a station wagon with a tackle box that was full of first aid supplies and some Narcan. And when there was enough staff, when it seemed appropriate, they would actually respond mobily occasionally. But sometime in the later part of the 80s, they worked with public safety here in Eugene because they realized that if they had a direct interface with the police non-emergency police dispatch, they could actually get to more calls and help more people that way. So they came up with this program, CAHOOTS, Crisis Assistance Helping Out on the Streets, but also Whitebird's kind of tongue-in-cheek acronyms that they like to do. We're kind of in cahoots with the police. We're kind of wearing this police radio, but not the cops. We're not the cops. We're just trying to help. And let us see if we can do something. And that relationship was a little bit strange at first, but they also really appreciated that we were taking a lot of stuff from them that they weren't really either trained to deal with or wasn't really their bag to be dealing with in the first place. And frankly, in a lot of municipalities, law enforcement had become and still is the de facto mental health response. And we built the CAHOOTS model around what we were already doing with our fundraising arm, which is rock medicine, where we would go out to music events, festivals. Back then it was like the Dead shows and Oregon Country Fair. We bring in about 100 to 200,000 a year on fundraising, bringing in volunteer medical and volunteer mental health staff to events and providing psychedelic harm reduction, medical services, crisis intervention. And in that model, whenever we would send out a response team, they would always include a medic and a crisis worker, so that you could really get a holistic look at the person, because sometimes medical issues present as mental health and vice versa, and you could be able to assess the whole person and decide what the next best steps were.
Cool. So I want to get into that tongue-in-cheek thing that you mentioned, the idea that you're in cahoots with the police. I'm wondering if that's a connection if that's something that you still struggle with, and how you approach folks in your work to make it clear that you're not the police, but you're fellow community members.
Sure. So I would say that one of the things we do is that we dress casually. So I'm going to go to a shift later, and we wear ball caps and hoodies, and really have always stayed away from any kind of too technical of a looking uniform. We try to really be casual as we can be. And a lot of times it's also just a conversation with folks up We do have the police radio on, but real quickly we can be like, look, we're a voluntary service. We're just here to see if we can help. You know what I'm saying? We're trying to keep the police and EMS and other people out of this. We're just going to check on you real quick and see if you're okay, and then we'll leave you alone if you don't want our help. And that piece in itself, I think, is a big way that we separate ourselves, because we don't show up on a scene and just proclaim that we're going to be there no matter what. You can't do anything about it. We're really clear. We're voluntary. You know, we're mandatory reporters. So if somebody's really not safe, we have to activate a higher level of care and do something else about that. But in general, I would say 90% of folks very quickly are happy that it's somebody else not in uniform that's addressing them, and are pretty quick to work with us on making a plan and trying to figure out how to resolve the situation.
So I'm also curious because, kind of devil's advocate here, some people might say, look, if you walk into, for instance, a conflict involving someone who has mental health issues, you need to have a weapon because you just never know. What would you say to that?
I'd say there's a lot of stigma around mental health in this country. And when we're talking about folks who are homeless, we're talking about folks who might have mental health issues or substance abuse issues, I think there's a lot of stigma that follows all those things. I think the statistics don't play out, that plenty of housed people and sober people and sane people commit crimes and are violent. And so, that stigma doesn't seem to prove out from our experience on the streets.
So talk a little bit more about the process. As I understand it, people can either call a non-emergency line right to you, but they can also be patched through via 911. What are some other parameters where dispatch decides that it's a CAHOOTS call?
Anything involving, we've really been pretty clear with our contracting with the public safety system and with the Eugene Police Department, that anything that has a mental health component, a substance abuse component, is something that we would like to be involved in and is really in our bailiwick. And that expands a little bit to also include, even if it's just, something involves somebody who's homeless, where there's somebody that's a man down call is something that municipalities experience a lot right now. And a man down call really should be somebody having a medical emergency. But with the advent of cell phones, folks can call any individual who's sleeping anywhere in the city on a sidewalk or somewhere in as a person down. And frequently, we call that cell phone Samaritans. You cared enough to call somebody to help that poor person, but you didn't stop to see if they were breathing or okay. And we frequently handle those types of calls, which really are overwhelming public safety systems across the country, because somebody has to go. There's a liability piece there where they need to send somebody to go check on that individual, but usually they're sending in EMS or police, and in some cases both, to every single one of those calls. And in Eugene, they don't. They send us. And if we go in and assess that it's a medical crisis or medical emergency, we'll call in EMS right away. If it's not, then we're able to just dialogue with the individual, talk about what's going on with them, see if we can offer some services and find some alternatives to kind of help them in some way. But the police have also expanded a little bit in Eugene over the years to what they'll send us to. Death notifications are commonly handled by the police. Where you have to go and tell a family member that somebody has passed, and we tend to handle that now because Eugene felt like having a crisis worker, mental health worker with services right there, referrals that they could give, is a better way of handling those types of calls. And we also do a lot of welfare checks where we'll go out, where somebody will call in and say they haven't heard from grandma for a few weeks and are worried about her or whatever. That typically would be an EMS or a police call, but frequently they'll send us to go and knock on the door and see if we can make contact with the individual.
Makes sense. I want to kind of circle back to substance abuse that you mentioned earlier. The war on drugs has been and still is devastating. Talk about the approach that CAHOOTS takes to this, and if you'd call it harm reduction, and what, if any, pushback you've had from that approach by law enforcement.
So yeah, I would say that we're definitely have a more harm reduction approach. I would also say that we focus on a more humanistic approach to human services in general, what Whitebread's called for decades client-centered services. And so we really try to focus on the human and not on whatever the issue is. And as far as substance abuse goes, Chrysalis, our drug and alcohol treatment program, um, they really try to steer away from the disease model, the idea that you're an addict and you're always going to be an addict and there's nothing you can do about that. You just have to come to terms with it and be an addict. Um, and instead, we talk a lot about relationships to substances and what is your relationship with those things and how is it impacting your life. And if the relationship's not working anymore, what else can we do and how can we get you to the correct services, supports that'll help you change that relationship in some way. And we look for those underlying issues, like what's going on in your life, what are the social economic things that you have going on that might make sense that you might be trying to numb yourself out a little bit. What are other ways that you can then deal with those things if there are other factors. And so by taking that kind of approach, we find that people are much more open to looking at services and stuff like that. And we're trying to build rapport with the individual because we know that the individual has to decide they want to make some changes. And so us coming in with a judgmental kind of approach and telling them how they need to live their life isn't really going to serve them. That what's more important is the individual feels empowered to make the changes they want to make and feels supported in whatever changes they do want to make. And so we may mention to somebody, hey, we've seen you like this now day after day for months, and we're really worried about you, and it seems to be getting worse. Does this seem to be impacting you? But we're going to try to ask those kinds of questions to them and see if they come to those answers on themselves more than we're going to come in as the know-it-all professional that's going to tell them how to lead their life. And I'd say that that's kind of at the crux of kind of our harm reduction philosophy. And I'd say in general, the state of Oregon, has lowered a lot of its drug penalties, especially for minor possession, down to misdemeanors. And so overall, I think the environment out here is more focused on that. How do we get treatment help to the individuals that are struggling with these things, and moved away a lot from a more punitive kind of approach. And so in that way, the local police department, I think, really appreciates the fact that we're out there dealing with it. And again, we're taking those calls and doing them so that the police don't have to, which I think takes the temperature of the overall public safety system down significantly.
As of right now, jails are the number one mental health provider in the United States. And as you've made clear, CAHOOTS is a way to avoid that interaction. But what happens after you meet them? Are they still ending up in jails sometimes? And do you see a way to continue the compassionate work that you do beyond just the initial meeting, but into the larger arena of mental health care?
So we try to route people into appropriate services. And that includes into our umbrella of services that we have direct connection into. And again, we try to see the whole person. And so we don't just have somebody who's maybe having some substance abuse issues, but we recognize what's the underlying issues. Oh, they've got medical issues that are unaddressed. Okay, well, let's see if we can get them connected up with our medical clinic to actually get them the care they need, because maybe by addressing that, they're then able to move on to addressing some of those substance abuse issues. So we work kind of on that way of trying to route people into the right services, including into the umbrella that we offer. On the other side, I think that any mobile response has the risk of becoming a road to nowhere. And even in Eugene, one of the struggles we have is a severe lack of shelter. We don't have anywhere near enough emergency shelter beds, let alone low-income housing for the number of folks who are experiencing homelessness at any given moment. So we sometimes are giving somebody a blanket and a tarp because that's the best we can do, because there's simply a lack of services that really are appropriate for them. The low barrier shelters, low barrier facilities are also a really big issue all across the country, and especially in Eugene. So that if somebody is actively struggling with substance abuse or has other issues going on, a lot of the options available to people are pretty high barrier and have very specific limitations. And that then just excludes a huge number of people from being able to access those services. One of the more difficult calls that I was on was with a woman who was intoxicated in the middle of the night. And she just was also cold. It was a cold night. there are 2 sobering beds in all of Eugene for an intoxicated female. So then the option is jail, which in most municipalities is the option because sobering centers aren't common in every municipality. A lot of times it's jail, the drunk tank, you know, and it wasn't appropriate. She wasn't committing a crime. She was a little bit intoxicated and cold. And so I gave her warm clothes and glove and hat and blankets, and talked to her about how, what places probably wouldn't be okay for her to try to get sleep at, but where she might be able to go. And it was poignant to me because she was super thankful for even that little gesture. Even though I felt like I was doing basically nothing, she really appreciated that I was at least treating her as a human being and recognizing and empathizing with her that the situation sucked, you know? And I think that that's the challenge across the country right now is that there is an overall lack of mental health services, of mental health beds, and especially low barrier shelter, low barrier beds for even shelter across the country, and that those two things have to be simultaneously addressed, or you're just throwing this a group of people at stuff that where they really aren't going to be able to solve anything or help anyone, you know. And we've tried to step up and assist where we can with that issue too. Our local mental health respite closed a number of years ago. Because of the bureaucrats and money, basically. And we were pretty unhappy with that. And we immediately turned around to some of our partners and tried to work out some temporary respites that we could run in partnership with other agencies, including just going to what's called a Conestoga hut. There's a group out here, community supported shelters, that builds these little kind of covered wagon looking huts. Is it ideal for housing? No. But if that's the best our community can do right now is a step above a tent, then we're going to pursue that. And we actually have a small number of those that we manage and place people in as an emergency placement sometimes because we're responding to that unmet need.
So, kind of wrapping up here, I want to talk about the sort of ripple effect that's happening here. Talk about the initiatives that CAHOOTS is kind of working on in other cities and what kind of hurdles you're encountering with regards to that, if any.
Sure. So we're in dialogue now with 20 or so municipalities across the country that are all looking at different ways that they might like to implement mobile crisis intervention. We're making ourselves available to help where we can, both with bringing people out to where we're at and giving them ride-alongs on the CAHOOTS van so they can see it. Because I really find that no matter how many times I talk about CAHOOTS or even send people information, written materials about it, they don't really get just how integrated the system is and how exactly it works and the wide scope that we really cover until they actually ride along on the truck. And so we really encourage people to at least send some kind of contingent out, ideally of potential community partners, others that are going to help make this program work or create something similar in their area, and try to get them to come out and at least do some ride-alongs and get some on-the-ground experience. We also are having groups fly us out to have talks with potential partners and people that might be interested in creating something similar. We're then demonstrating, putting together packets of information that could include, look, this is how we've developed our contract. This is what our protocols look like. This is what the dispatch protocols look like. Here's our staff manual. And again, trying to use it as a way to bring funds back to the agency and support our staff time and also have some extra money to put back into client services here in Eugene. But we're trying to be available to help whatever communities want to move in that direction. Now, the trick is that every community, every state has different rules and regulations around how an EMT has to function, what the right qualified level of a mental health worker is. And they have similar things in place in Oregon, but they're not always exactly an analog to what we're doing. And so we have to really work with them within whatever systems they have too to figure out what the best approach is. So in Olympia, which was one of our first success stories, partly because the police chief in Olympia happened to be a former Eugene police officer, so he knew CAHOOTS worked and he had experience with it. So he brought us up, we did some consulting and some work, helped them get a program set up, but putting a medic on the truck in their particular with state laws and regulations around how EMTs had to function up there wasn't really something they could do. So their model is more around a couple social workers on a van that respond. Although it seems to be working. I mean, they're doing a lot of work specifically with more of a working with individuals who are homeless kind of target, but it's working. But it's their own model. Portland is moving forward right now with a crisis response model that we're going to help with their model. We really advocate for a third party outside of the city government and normal kind of city department functioning. But in their case, they really wanted to embed something right in the fire department. And they wanted to be a part of the fire department and simply add a mental health component to like more of like a community paramedicine model. And that if that's what they have the political will to do right now, and that's what their area wants to do right now, then we're going to support that. Now, do we think that that's ideal? Maybe not. We're not sure. But in the moment, we're going to go and help support them in how that works and how our model works and who you should hire. With that model and with a lot of the other models, we focus on that who do you hire piece, and we talk about lived experience, peer supported. When we're looking at staff, a lot of times we're looking for folks who have had some kind of experience with mental health, substance abuse in their lives. Maybe a family member, maybe themselves, maybe, just some close friends. But we see that as those people are usually the most successful at really being able to have the kind of empathetic approach, the kind of compassionate response that we're looking for. And so when we're helping these other municipalities set up, we talk a lot about that lived experience piece being really necessary in the people you hire. Because otherwise you're going to end up potentially with somebody who's maybe got a lot of training and a lot of letters behind their name, but do they really have that empathetic human level understanding of what it is to suffer with those kinds of issues?
For more on the work that CAHOOTS does, visit whitebirdclinic.org/CAHOOTS. And that will do it for this week's Dose of Dissent. Thank you so much for watching. Be sure to sign up for our newsletter, and if you can, donate in order to keep our work going. From the Devil's Den, good night and act out. And real quick, to keep independent, non-corporatized media like this show going, visit patreon.com/actout.
I can hear the roots are stomping. Come on, boys, let's get some rocks to throw. I can't stand to hear my father cry anymore. Time we left one of you motherfuckers dead in the road. We've been backing up inch by inch. We got nowhere else to go. It's been too many years since you pushed and set my shove. I'm not a violent man, but I will kill for what I